Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of Geriatrician Dr. Andy Mencia. Made me think about this.
Yeah.
Dr. Mencia, good morning. I'm looking out at the wonderful sunrise.
Beautiful.
And everyone's paying attention to what you said about sunstroke.
Sunstroke.
Well, let's talk now about stroke.
Stroke, yeah.
I'll tell you why I brought that up. We, at our expo, which was fantastic, we have a musical
Congratulations.
group. Yeah, thank you.
Yeah.
Well, everyone asks about
They
you.
always-
They
they
always
always-
want to
yeah.
know about where's Dr. Mencia. He's up in the clouds flying over the, but,
Doing a thousand,
yeah,
a
right. But
thousand
Dr.
things.
Mencia, we have had a musical group, 2 people. They play, they're wonderful. One sings and then one plays music. And he couldn't come, and he had a stroke. He must be in his 60s, had a stroke, and he was in the hospital.
Mm-hmm.
And they said he was talking, he could speak. But I thought, we've never really talked a lot about strokes.
No,
Could you really tell us about this?
It's interesting because when you're going to get a cold or something, you're going to get bronchitis, you have some symptoms that give you the warning that something really bad is coming about, it's about to happen to you. If you're going to get a urinary tract infection, if you really listen to your body, you get some symptoms that we tend to ignore. Let's say if I go and urinate 3 times at night and suddenly I get up 6 or 8, we say, no big deal, it will go away. Then you get a little burning sensation, then you get a little fever, and it gets bigger and bigger and bigger until you say, okay, I need help. But in reality, we get little warning signs for many diseases. Let's take, for example, diabetes. You are prone to being a diabetic, so you start urinating a little bit more frequently. You never go into burning or anything like that because it's not an infection. It's just that the sugar is a diuretic. It makes you go and pee more than what you normally would do. And then you start getting thirsty. And then, the sugar start rising. Then you start losing muscle mass. And it keeps increasing until you go to a doctor and your sugar that is supposed to be under 100 is 300 and something, 400, 500, and can even throw you into a coma. But then we look back and say, wow, I ignored those warning signs that were coming at me. Stroke, there's no warning sign. It's just a catastrophe. I had a new patient that came to see me, 32 years old, was taken to the hospital because he couldn't express himself. And because he couldn't just talk, the body was okay. They just, got in the car and his girlfriend was driving him. By the time they got to the hospital, she parked the car. She said, come on, honey, let's go to the emergency room. He couldn't walk now. He couldn't move the right side. So she panicked and ran and, called somebody to help her at the emergency room. They got a wheelchair, full-blown stroke. He will not recuperate. And 32 years old. This musician is on his 60. But people think, well, stroke is not going to happen to me because I'm too young. Or I am already 70 or 80 and I never had a stroke, so it's not going to happen to me. There's no limit. There's no warranty at any age. From a kid to my grandfather that was 109, anyone, at any age can develop a stroke. And a stroke is an insult to the brain. You can have a brain attack, you can have a heart attack. And they are both basically similar pathophysiology, similar mechanism of how they occur in our body. For example, a person can be having the blood pressure that start elevating. And we call hypertension the silent killer. It's another silent one. Because if your normal blood pressure is, let's say, 110 over 60 or 70, and every time you go and get checked, it's around 110, 115, 108 over 60, 70, 60, 70, 66. Suddenly, something is happening in your body that your blood pressure start rising, but you will have absolutely no symptoms. So you will go from 120 to 130 to 140 to 150.
Over a period of time or what?
It depends. What is the cause? So let's say, let's go back. One of the most dramatic increase in blood pressure without you noticing that it's going on is when the arteries that feed the kidneys start shrinking on you. Let's say you develop a clot that went into the artery and settled there, and now the lumen by where the blood go through have decreased by 50%. That's a big decrease for that kidney. So that kidney is going to start doing all kind of chemical reaction because say, hey, why am I not getting blood and you are getting blood? So start doing all this chemical reaction in response. But those chemicals that are being released is going to go and increase your blood pressure. So it make all the blood vessels in your body start tightening up. And it's a process. So you release, let's say, spironolactone, aldactone, blah, 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 epinephrine, norepinephrine. You start releasing all this chemical from the kidney. Angiotensin, all these chemicals start coming out. As they come out, they produce big amounts. It's like when you take a pill, right? If you take a pill and you start with 10 milligrams, 20 milligrams, 30 milligrams, 40 milligrams, 80 milligrams, the higher you go on the dose, the bigger effect you're going to get. So as these chemicals start elevating, your blood pressure start going higher and higher and higher and higher until it bursts. And it can burst in your heart or it can burst in your brain and give you a sudden stroke. Now, going back to our musician, one of the other causes of stroke is stress. So he probably putting himself together to come to the expos and, do a good job. And maybe some of the players were not sure they're going to make it. All the stress start coming. His wife said, you didn't buy me what I asked you for.
Always the wife.
Yeah, the
Always
kids.
the wife for the husband.
The kids come like, it's my birthday. What you we're going to do? So all these things start coming at you. All these stressors start coming at you. Plus the fact that something is broiling inside your body and you add all those up at the right time, it becomes the perfect storm.
Okay, wait. So I want to stop you for something. We blame stress for a lot of things. What is stress doing to your body? Is it closing down your...
Well, the chemical reactions. When we have stress, you're walking down a dark hallway and I come out with a knife and I scare you with a gun and a mask on me. Your body will go into this, what we call in psychology, fight or flight situation. All the adrenaline, all these things start being released. All these chemicals get released. So that your body, if you need to run, your heart start beating really fast because the heart is the pump, right? So it start beating really fast, trying to pump blood. And it's doing that because it want to get you, if you're going to run, that you have enough blood on your legs so you can start running away from the situation. Or if you want to fight, that you have enough blood in the system so you can kick and punch and do whatever you need to do. So it's called a fight or flight situation. And that's one of the classical example we use to express what stress tends to do to us. And that's like a surge in stress. But, sometimes we get stressors that they are constantly there. You are in a relationship with somebody that is just constantly keeping you unhappy, under a lot of stress, and you just let it build up. And, You start doing all kind of stuff because of the stress. You get rid of that relationship and suddenly you feel better. Your body feel better. But until it's out of your life, you won't recognize it. It need to be out of your life, then you recognize it. That's why, some people that are in abusive relationship, they stay there. They need to get out to say, oh, this is the real life.
No, I understand that. So you were answering my question there for stress. So you're saying that stroke, the body's having to work harder because they're under a lot of stress, and that's what could be driving what you said as a stroke.
Right. So, then you have that. Then you have your eating habits. The food that you eat need to be processed. If you eat what we call healthy food, people think, oh, it's healthy because and that's a unfortunate thing. People think it's healthy because my cholesterol is high, so I'm eating healthy for my cholesterol. You have to eat healthy for your entire body. So when we eat junk food, you go and grab 2 or 3 hamburgers, and you eat 2 or 3 hamburgers with cheese and French fry and blah, 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 and Coke and what have you. It's going to require a lot more energy than when you eat healthy food. Healthy food tend to be easier to process for your body than junk food. Let's say require when you eat a lot of heavy fatty food in your body. When you put heavy fatty food, it takes a lot of energy to process that. So it's the difference between burning a piece of paper and burning a log of wood. It's going to require more energy to burn the wood than to burn a piece of paper from the newspaper.
Have you always been able to equate something simple with something? I love this. I think you should write a book about that. I mean, I just love the way you do that. That just comes to your brain, doesn't it?
Well, yeah, I've been teaching Taekwondo to kids for so many years. And the beauty of Taekwondo is not the kicking and the punching. It's the discipline, the history, and the philosophy behind it. That's the most important, to me, that's the most important part of Taekwondo.
It's obvious, isn't it?
And for many, many years, and I love teaching kids because kids are like sponges. They just absorb, things. We are the one adult that teach kids, like, don't like this guy, don't like that guy. We put the prejudice on them, but kids are, sponge, naive and ready to learn and be open to whatever we want. So teaching kids, and, you cannot discriminate against kids, say, well, it's a little kid, so why am I going to teach history? Why am I going to teach philosophy to a little kid? And from a very young age that I've been teaching kids to the very recently, I love passing on the discipline so that they can become good, better person in the future. And it has worked. I see those kids grow up to adult, men and women. And, they are successful, most of them. I just have one of them that called me. He lives in Miami. And he said, oh, I have a company. I'm an engineer. I have my own company. And I have a construction license. And I do this. And I say, wow, I'm so proud of you. So...
So you think in terms of simplicity. So when you say to someone about it takes more energy, and you don't say anything else,
they won't get it. Exactly. They won't get it. It's important that we understand. And then when you make that decision of which life you want to live, you don't have to have a stroke. You won't get any warning sign, but you don't have to have one. You can prevent a stroke 200%.
Sounds to me like
100%, 200%.
You want to put your body on a vacation all the time rather than on a stressful work.
No, you want to be active. Vacation, we always think of vacation as relaxation.
Yes.
It only take about 10 minutes of meditation every day to go on vacation. People ask me, when are you going to go on vacation? When are you going to take a break? I say, I take a break every day in my life.
That's very good.
So, vacation is not, you don't want to be sedentary. That's another risk of stroke, a sedentary life.
Is that right?
Absolutely. You want to be active. And that's, I learned that from my grandpa. Because we used to say, Grandpa, how you got to be so old? He would get up every morning, 3, 4 o'clock.
I love your grandpa's stories.
3, 4 o'clock in the morning. He said, I have to have something to do every day. I get up every day and I have to have something to do. And we remember that when he couldn't go into the field because he wasn't feeling well, he had this pile of coffee. We were like farmers. We were, farm kids. So he has this pile of coffee that he would spread out and then let the sun dry it up. And then he would pile it up again. And my uncle, when they see the coffee was ready, would take that coffee out of there and put another pile there for Grandpa to play with.
That's absolutely fabulous.
But, we have to have something to do. And I get up every morning, with a smile in my face and happy because I had things to do. I always had things to do. I posted, you saw a few pictures I posted on Facebook with some of my patients. And, they are my go-to.
Well, while you're going to, I'm going to go to your company, your organization. It isn't a company. It's really a wonderful medical practice. It's unique, everybody. And I just rave about Dr. Mencia all the time. And his name is becoming synonymous with the right way to have medicine handled. I mean, there's so many people that have no idea what really good medicine is. And we've talked about Dr. Mencia being a geriatrician, not just a medical doctor, but he's also a philosopher and so many other things. He is. He's really is a man's man, a woman's man. I don't know what he is, but the name of the organization, both. Yes, you are. The name of the organization is AGI Medical and Dental Centers. He runs right after this show every Saturday morning down to Fort Lauderdale to take care of all his patients who just wait for him. His address there is 1608 East Commercial Boulevard. It's between I-95. It's very close to the Holy Cross Hospital. And the phone number, just get your pencils out. Remember, we've talked about this. Get your notebook. This is a very important phone number for you. Don't wait until you have a stroke, please. We're not saying you're going to, but have yourself checked. Just go in for a consultation. You don't have to have one. That's right. It's a silent situation. Why don't you go and have him check you over? You never know. You might find some glorious things that you weren't even aware of. Phone number is 954-489-1345. 954-489-1345. And it's been, it's over 2 years now that they are in Boynton Beach. Everybody asked him, please do something in Palm Beach County. And, of course, when you ask him, please, and he sees a need, he's there. So now they have a wonderful crew over there in Boynton Beach. A lot of good medical practitioners there at that office. That's 561-270-6494. These are just phone numbers that you may not even think about until you need them, but please write them down. And the best thing of all, for me anyway, in my profession, is that he has home visit services available for homebound patients. Actually, you see, we were talking about stroke this morning, and
that's been a blessing to so many families.
Oh, absolutely, because they're lying there, and they're waiting to have a stroke, in a sense, that no one's helping them. They don't know what to do. It's a wonderful thing that you've done,
and
Dr. Mencia.
With the different agencies that we work, the home visiting nurses, social worker, physical therapy, occupational therapy, we get whatever that person needs at home to improve their quality of life. So that had been a great thing.
Because and I don't want to say this, but I do feel it, they're really the forgotten population. They really are.
We ignore them. We ignore them so much. So, and
what do they have
unfortunately, there are no people in my field as a geriatrician.
Who are doing this? No one's doing this.
Nobody. Well, there are people doing it, like nurse practitioner by themselves, or people are trying to cover the knee in different way. But most of us geriatricians will get so absorbed by either becoming a medical director in a hospital, running a geriatric program, a teaching program, or running a practice like mine. But what I have done, I say, since the beginning, I say, when I do my geriatric medicine, I want to cover the whole spectrum of what is geriatric medicine. I don't want to ignore anybody.
No.
So even when my patient go into hospice, they still part of us.
Yep. No, you do take this very seriously.
Right.
And I think a lot of people understand that about you. And before we're not close, but before we finish, I just want everyone to know that Dr. Mencia and I are going to be treating you to a real television show. And it's called, he's Dr. Wow, Wonderful World of Wellness. And it will be seen on YouTube. And we're going to let you know, hopefully within the next couple of weeks, we're going to be able to put this together. So you'll be able to see this gorgeous, attractive man inside and out.
With this beautiful lady.
Oh, yeah, with our friendship. And for you, though, who really want to see us, and we're going to have wonderful programs with a lot of the people. You'll be able to see the people who he brings to these shows. You have such dedicated, I want to call them friends, but they're really associates.
Yes, a lot of associate people that we work with. I don't want to leave the topic of stroke without talking about the kidneys.
Okay.
Because,
that's your famous...
we're talking about not having one, but preventing one. A 200% method of preventing stroke. And I wrote a book on the kidneys, on how to protect your kidneys so the kidney can protect you. And I see so many patients with slightly elevated sugar. And they say, I went to the doctor and they told me I'm not a full-blown diabetic, so I'm okay. And I say, okay, to what? Okay, to wait to become one? Or look, when you have diabetes, you are more prone to bleeding, so therefore to having a hemorrhagic stroke that will kill you. Diabetes makes you more prone to having a heart attack. Diabetes makes you prone to losing your extremity. And diabetes, when you have what people like to call, I only have borderline diabetes. As long as the sugar is above normal, it will produce damage in your body. So you have to work hard at decreasing the sugar. And a lot of time I have patients that I say, look at your kidneys. And they say, doctor, but it's not flag, it's not red, or it's not, blue versus black. And I say, well, it's not flag, but look at the number, it's dropping. And when you see those numbers dropping, when it's flag, then you are in trouble. But look at the level. So you have your sugar that you want to make it under 99, and you are 103. That's not a big deal. The kidneys start dropping on you, and you let that be, the kidney will continue to drop in value, and then you become stage 2, stage 3, stage 4, dialysis, what have you. But that's what preventive medicine is all about. It's not treating things that are abnormal. That's medicine. That's not preventive medicine. Preventive is how do I prevent you from having kidney damage? And the consequences of kidney damage, along with everything else we have mentioned, is that you can have a heart attack or stroke. So you need to monitor your kidneys. And the myth...
How does one do that?
Monitor, well, when you get your blood test, you want to know what's your glomerular filtration rate, called the GFR. So a lot of time we look at the BUN, the bone, the creatinine, right, that comes from the urine. And then we take those numbers with the person's age and what have you, take all this into a formula, and we come out with the glomerular filtration rate. Glomeruli are the filters. We have millions of filters in the kidney. So the rate at which those filters are working. So if you have an air conditioning in a house and you have, let's say, 20 outlets at the air conditioning, Then you start doing construction, a lot of dust come out. And they start plugging those filters that you have there. The air is still coming the same. The air didn't stop. So the machine pumping the air, that's your heart. The filter that you have in your house, those are your glomeruli. So if you do construction, let's say in this room where we're sitting now, and now in Richard's room, Richard's filter is still working good. So that side of the kidney is working good, but this side of the kidney is shutting down. So you start losing filters little by little. The quality of that filter start going down. So you have, let's say, 90% of your kidney working. And it won't be flagged. 88%, 85, 84, 64, boom, now you're flat. And then when you go under 60, you say, oh, maybe I just had to drink more water. That's not going to do it. Okay? It's controlling your blood pressure, drinking water, following a good diet. But now you are not preventing anymore. Now you are reacting to the fact that you didn't take care of your kidneys.
So we want prevention, not reaction.
No reaction.
And Dr. Mencia, thank you very much. It's been always wonderful. Let me give you his phone number. He is open on Saturdays. That's where he's rushing off to. I keep trying to get him to come out to breakfast with me. He says, I can't have to go to my patients.
No.
Yeah. He's anyway, 954-489-1345. Visit him for prevention medicine. Don't have a stroke. And if you're, make sure that everything is working, but you need to have tests, as he just said. Thank you, Dr. Mencia.
Thank
have
you,
a
Anita.
great day.
Always a pleasure.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.